everyone, welcome back to Cephaly. I'm your host, and today, I want to talk about something really interesting in public health: the iceberg phenomenon. You might have heard of it, but it's a concept that really opens your eyes to how we see health issues. So, let's jump right in. Picture this, an iceberg. We usually only see the tip, right? But underneath, there's a massive structure hiding out of sight. In public health, this analogy helps us understand that while some health problems are very visible, like outbreaks of diseases, there's a whole lot happening beneath the surface that often goes unnoticed. That's the iceberg phenomenon. Let's break it down a bit. The visible part of the iceberg represents acute illnesses, conditions that have visible signs and symptoms, which are essential for a physician to perform their job. Think of flu outbreaks or hospital admissions. These are the issues that grab headlines and everyone talks about. But what about the hidden part? Chronic conditions like diabetes, hypertension, or even mental health disorders can be lurking beneath the surface, affecting many people without them even realizing it. This hidden part, which is of particular concern to epidemiologists, represents the asymptomatic population, individuals in the subclinical stage of disease progression. For every diagnosed case, there are likely many more individuals who are unaware of their condition. The water surrounding the iceberg represents the healthy population. This concept is super important for public health. It tells us we need to look beyond just the visible problems and consider the bigger picture. For instance, health education. When we raise awareness about these hidden issues, we empower people to take charge of their health. Screening and prevention. Regular checkups and screenings can catch chronic diseases early, making a huge difference in treatment outcomes. Resource allocation. If we really understand the full impact of diseases, we can better allocate resources and support to where it's needed most. So, as we wrap up, remember this: the iceberg phenomenon reminds us that not all health issues are visible. While we often focus on acute illnesses that grab our attention, chronic conditions can be lurking beneath the surface, affecting many people without them even knowing. Epidemiologists are particularly concerned about these hidden health issues because identifying them is crucial for effective public health strategies. Now, here are a few key takeaways for your entrance exams like NEET PG, USMLE, and FMGE. Understand the distinction between visible acute illnesses and hidden chronic diseases. Be aware of asymptomatic conditions like hypertension and diabetes that might not show clear symptoms. Recognize the implications of the iceberg phenomenon for public health, as it can often appear in exam questions. So, let's not just look at the tip of the iceberg, let's dive deeper into understanding the full picture of health. And if you found this video helpful, don't forget to follow us on Instagram at cephaly.company for more medical insights and updates.